Hi guys, welcome back to the channel. For those of you that are new, my name's Kevin. I am a new grad nurse who graduated with a 4.0, and my goal with my videos is to break down nursing school topics into easy digestible video sizes that you guys can watch on the go, and just briefly give you guys a brief overview of the topic. So, something that I wanted to talk about today to keep up with last week's theme of cardiology is I'm going to be talking about PAD and PVD, so Peripheral Arterial Disease and Peripheral Vascular Disease. These were two topics that came up a lot in the first semester for me, and a lot of people seem to struggle to remember the differences between the two. Now, you guys could do it the hard way and just memorize all the signs and symptoms, but I don't recommend that. That's not the best way to study for nursing school because there's too many things you need to remember. I'd rather you guys just know the trend of how something goes than to memorize everything, okay? So I'm going to be showing you guys a slide from the exam review slides I used to do when I TA'd for that class, okay? So we're going to start off with PVD, okay? So basically it's when the blood vessels in the lower extremities narrow. We're talking specifically about in the legs here, okay? So, pain. It's usually worse when they're standing, and it's better with the legs elevated, okay? They often feel tired and heavy. Now, the way I want you guys to remember that is I want you guys to make a V with your fingers, or like a peace sign, right? Or the number 2. Pretend these are your legs, okay? So, you know how it looks like a V, right? Treat them as your legs. You want to keep them elevated, all right? Because what we're trying to do here is because the blood is usually pooling and collecting in your feet. So when you elevate them, you're letting them drain back down to the heart with the help of gravity, okay? So this is why the pain's better when the leg's elevated. Pulse, it's usually 2+ or 3+. This is how we grade pulses. 2+ is normal. Some places uses a different scale, so some places uses a 4-point scale, so 3 may be normal for them, but it just really depends on facility. Most of the times we say 2+ is just normal. The capillary refill is intact, so when you push on the nails or the tips of the toes, you should see the blanching go away quite quickly, right? The whiteness goes away, and you should see that the pink rush of blood come back quickly. Edema wise, there is usually some edema, and it's brawny edema, okay? And the reason why it's brawny is because of all that stagnant blood just pooling there, okay? That's why the edema is brawny, okay? Temperature wise, it is warm and flush, like I said, because all the blood getting to the legs, all right? It's going to be warm. Color, it's going to be normal or brown pigmented because there's not a problem with the blood going to the legs. It's the blood can't come back home to the heart. And then wounds, this is usually like very specific, and I did get some questions on this, but it's usually very rare. But this is probably the only thing you need to memorize specifically, which is like the irregular shape, and they're usually on the sides of the ankle with some granulation. Okay, so the biggest theme that you guys should take away is that you should make the number 2 with your hands or a peace sign and think of that's how you treat it, right? You want to keep the legs elevated because the whole theme of PVD is that the blood can get to the legs. It has no problem getting there. It just can't come back, right? So that's why there's all the edema because the blood's pooling there. The color is brown or normal, right? And then the temperature is warm, right? There is blood flow to the leg. It just can't come back home, okay? Now, on the flip side, we're going to be talking about peripheral arterial disease. This is when the arteries are narrowing from the plaque or causing a reduction in blood flow. So this is the complete opposite of PVD, okay? This is where the blood can't even get to the legs, okay? So let's talk about the pain, right? You're going to have that intermittent claudication, usually, which is like cramping, and that's induced by exercise and relieved by rest. So the reason why it's induced by exercise is because you're increasing the oxygen demand, right? Because your muscles are contracting and all that stuff that you guys learned about in anatomy and physio, right? and that's why you have pain when you move. And then when it's relieved, it's not constricting so hard. Yeah, if you don't treat it, there can be pain at rest. Now, pulse-wise, it is usually weak, absent, unequal from the other side, and has poor capillary refill. This is different from PVD, right? Because like I said, PVD, the blood can get to the legs, but it can't come home. PAD, the blood can't even get to the legs. It can't even get there, right? It's not even going to the toes. So that's why you're not going to have really good cap refill. You push on the nail, it's going to take forever for that nail to turn pinkish color, or like, return to the person's normal color again, right? It's going to have a weak pulse because it's going to take forever for the blood to get there. It might not even get there all the way because of the narrowing from the arteries, right? Edema. No edema. Why don't we have edema? Again, the whole theme of PAD is that blood can't get there. So if you can't even get the blood there, you're not going to have the swelling of the ankles and all the edema, right? Because there's no blood there. There's no fluid going there. Now, temperature, it should be cool. Once again, right? Blood is warm, and if there's no blood going there, it's going to be cool. Color, it's going to be like blue, it's like cyanotic, gray, or pallor, because once again, we get our color from our blood, right? So if there's no blood getting there, they're going to have a discoloration, right? And also keep in mind that people with darker skin tones may appear ashy, okay? So don't get tricked on the exam if they're like talking about a specific skin color and then they're saying like you don't see like blue as an option, right? Because sometimes they may describe it as ashy, okay? Wounds, like I said, it's usually the one thing you need to memorize, which is that it's regular in shape and it's on the toes, heels, pale base, and it has well-defined edges. So, like I said, don't really try to memorize all of them. If you do choose to memorize something, I'll probably just memorize the wounds, because for me, these were the hardest things to like stick in my head. But you guys should just understand the general trend of these. So you make a V or a peace sign with your hands for PVD, right? And then for PAD, you want to flip that V upside down so it kind of looks like an A. And that's how you know that you should dangle, okay? And keep your legs like, dangling so that blood flow can get to them, okay? So just once again, in summary, PVD is where the blood can get to the legs but can't come home. So that is why you need to, keep the legs elevated, and that's why you'll have edema, and the temperature will be warm, and you will have a pulse, okay? Whereas PAD, the blood can't even get to the feet, so therefore you're going to have weak pulse, no edema, and cool temp and discoloration, okay? So hopefully this really helps make memorizing and understanding PVD and PAD a lot easier, so that way you can save your brain space for harder topics. All right, good luck studying.